Ask the doctor question. Let's have a look. Dr. Hanson, is it true that down there is self-cleaning and it's best not to use soap inside? Well, the answer is it is best not to use soap inside. It is true that down there, so your vagina, your vulva, the whole area is essentially, I'm not going to say self-cleaning, but it's essentially an area that should not be exposed to harsh chemicals, a lot of soaps or a lot of abrasive, rubbing, or even putting anything inside the vagina that isn't prescribed for a specific reason. And the reason being is there are a lot of healthy bacteria and healthy microbiome in the vaginal area, and that is needed to be there in order to keep the vagina healthy and the skin and the mucosa of the vagina intact. So putting any chemicals in there or soaps or douches or rubbing inside for any reason will break down that important mucosal layer and that skin layer, and it can really create a lot of irritation. And if there's an imbalance in the normal bacteria and the normal growth, the lactobacilli are the normal healthy organisms that are there. If there's an imbalance, then it can become a yeast infection or a bacterial infection, and those may need treatment. So if you're noticing that you have a discharge, that you have an odor that seems new or really unusual or unpleasant, those are the things that you need evaluated with your healthcare provider to figure out what's going on down there. Otherwise, really, I recommend just normal water, showering, sort of maybe the shower head, and even gentle, potentially gentle soaps or cleansers externally to that area if absolutely needed. For people who are really sensitive down there, though, water is best. And water is a solvent, it's a cleansing solvent. So water by itself will make a difference.